So the big pieces to take away in terms of what research has confirmed. So we've identified the neural circuit of distress and how those three areas sort of play into each other. We've also identified what kinds of changes those areas have. So for example, the volume of the hippocampus shrinks, the amygdala becomes overactive. They've identified the neurochemicals involved, particularly related to the fight or flight response. In terms of treatment, there are a number of effective treatments that have been supported by literature in terms of how to work with individuals who have PTSD, whether they're children, adolescents, or adults. Where most of the emerging research lies is in identifying other areas of the brain that have been affected, what neurotransmitters are in play when PTSD is occurring or when someone has those symptoms, the impact of therapy or treatment on those specific brain areas. What is happening when someone has had a course of treatment? Does their brain change? Is that possible? And then what sort of prevention or early intervention strategies can researchers and clinicians develop and utilize when someone has had a traumatic experience occur? What can we do right away to make sure that this sort of symptomatology doesn't develop? What research tells us generally is that the brain is resilient and it's flexible. Just like these changes can happen because of trauma, changes can happen with treatment too. These do not have to be permanent changes to the way in which someone's brain functions. So in terms of treatment recommendations, I'm going to make just some very general recommendations and then highlight just some of the specifics. So important things to remember. Understanding and compassion are really important. In many cases, the wounds of a trauma are not visible. People may have physical injuries as a result, but when there's a psychological trauma, you can't see this on somebody. So we have to understand, we have to be compassionate. It does not mean these individuals are not struggling. Support is also important. Remember those mediating factors post-trauma. Remember, if someone is trying to actively cope and reach out for support and assistance, provide that support to them. Do not be dismissive of their experience. Remember the piece about the recovery environment. And if it's harsh or rejecting, that person is much more likely to develop symptoms than if they enter a recovery environment that's very supportive and understanding. The final piece is education. PTSD, along with many other mental health conditions, can be misunderstood. Symptoms can be miscategorized. One of the biggest miscategorizations that happens is among children who, when they've been exposed to trauma, tend to have a behavioral reaction. So these kids can actually present as really hyperactive. They might run around the classroom and seem like they're out of control and be very sort of silly and emotionally dysregulated. And you think, my gosh, this child is such a problem. That's actually one of the ways in which they show symptoms of trauma. So education is really important. Get some information about what those symptoms actually look like, what they look like developmentally, how people might respond, so that we can better categorize and give people the assistance that they need. Finally, in terms of formal treatment recommendations, what happens when a mental health professional encounters someone who has a diagnosis of PTSD? What would some treatment recommendations be? The first would be psychotherapy, talk therapy, counseling, whatever your flavor is in terms of what you like to call it. So exposure-based therapies are common and evidence-based. So we talked about sort of the curse is the cure here. People are going to enter therapy and talk about their trauma, but they're going to do so in a way where they've developed coping strategies, they've developed ways of handling these really uncomfortable symptoms so that they can process through what happened to them. Medication is also recommended in some cases. This is often to help people manage their anxiety-based symptoms. Again, fight or flight is really uncomfortable. People may need something to help them manage those symptoms quickly. And finally, combination treatment. So some kind of medication and therapy-based treatment in combination with each other. And this is actually what's been shown to be most effective in terms of how to treat individuals with most traumatic stress responses. All right, so my last sort of formal slide here are some resources for